Okay, cool. Well, yeah, thank you for having me today virtually. I'm going to be giving an overview of the HRB Open Research platform. So first, I kind of wanted to start by what we actually kind of mean by open access and kind of go back to basics on that. Open access, as you know, is kind of a term that's kind of thrown around a lot, and it's kind of not always clear what we mean by that. So the way I kind of think of open access is it's part of this kind of larger faucet of kind of open science in general. I thought this was a nice quote. So kind of open science is the idea that scientific knowledge of all kinds is shared as early as practical in the discovery process. So kind of transparency throughout the process. So obviously for different people, this means different things, but kind of the idea of kind of open data, open source code for software, open methodology, and then kind of moving more into publishing, so open peer review and open access as well. So the open access movement, kind of as we consider it as publishing, really started in the kind of early 2000s with the Budapest Open Access Initiative. Shortly after this, PubMed Central was established, and then we had the kind of first open access publishers come about in the early 2000s, so PubMed Central and PLOS. And kind of the idea here is that, yeah, there's a lot of kind of open access going on at the moment. So the movement's evolved quite a lot over 20 years. So we've actually now got over 13,000 open access journals that are listed in the directory of open access journals. And estimates say that around kind of at least 28% to 30% of the scholarly literature is open access. And a growing number of research organizations and funders are putting open access policies and often mandates in place as well. So these kind of look like quite positive numbers, but actually kind of many open access advocates consider this to be quite a slow moving process, which is quite unfortunate, as there are some kind of clear advantages to publishing open access, which I've listed here. So one of the most known ones, and there's been a lot of different studies into this, but the majority of studies find that publishing open access gives you a citation advantage, which really can kind of vary from field to field. In fields like ecology, one study actually found that the ecology kind of papers published open access had 600% more citations. So yeah, it can be kind of a large advantage to publishing open access. Also as well, kind of broader societal impact, and also open access journals are often interdisciplinary, so allowing you to kind of publish research that doesn't always kind of fit narrower scopes of traditional journals. And a lot of people feel with open access as well is that there's this moral obligation that the taxpayers who are often kind of funding the research should have access to the kind of results of this research as well. So kind of where we are with open access at the moment is quite an interesting point. There's actually been kind of a lot more of a top-down push for open access publishing, particularly kind of more from the funders. So you may have heard of Plan S, which is a group of national research funders from kind of all over the globe who will be mandating, it was 2020, it's now 2021, that all research they fund will need to be published open access, and actually the SFI have signed up to Plan S. So yeah, it's kind of interesting to see this top-down approach to kind of, yeah, help progress open access and kind of these changing requirements of funders as well. So kind of, yeah, this drive towards openness, but also alongside that accelerating impact. So that's kind of the background of where we are at the moment. And this is kind of the backdrop of what HRB Open Research launched around. So the publishing platform was launched by HRB in February 2018. So the journal is owned by HRB, but it's run by F1000 Research, which is who I work for. So we kind of consider ourselves as service providers. And HRB Open Research is actually one of several funder platforms we run. We also run funder platforms. We started with the Wellcome Trust, which is called Wellcome Open Research, the Gates Foundation, Gates Open Research, and we're also working with the Association of Medical Research Charities and the NIHR. And then also we've just been awarded the contract by the EU Commission to set up a publishing platform for the Horizon 2020 grantees, which will be called Open Research Europe. So for us, it's a really exciting time to be working with funders who kind of want to shake up the publishing system and ensure more research is published openly. So HRB, their kind of motivations behind it was really setting up the platform as a kind of service for their grantees, somewhere where their grantees can publish quickly, easily, openly, and with the costs covered as well, and ultimately really kind of improve the way the research is communicated. The process incorporates kind of preprints, open data, open peer review, and I'll go into how the publishing process works in a bit more detail in the next couple of slides. The platform as well really kind of complements other HRB initiatives as well, such as their kind of research data policy, and also their involvement in North, which is the national framework on the transition to an open research environment. So yeah, the platform kind of really plays into this kind of open science agenda in Ireland. The idea as well is that it also allows HRB to support reproducibility. So we publish a range of article types. So we hope this will kind of reduce research waste, accelerate impact. And also the idea behind the platforms is really to kind of look into how we're evaluating researchers as well, and hopefully start to do this in a bit more of a holistic way and help us kind of shift away from impact factor and kind of perceived impact, which we know is not a good way to be evaluating individual researchers. So the idea behind kind of all these publishing platforms and the ones the funders have been involved in is really kind of a different and improved way of publishing research. So kind of looking at the ecosystem, how it is, and kind of tackling some of the problems that we feel exist in it. So there we go. Yeah. So the first problem we really wanted to tackle was speed. So we know kind of often it can take 6 months to a year to get a research article published, which is not a good timeline. It often means the work, when it's published, can be quite outdated, and it's also been kind of stuck behind editorial closed doors that whole time, so it's not been kind of accessible for the community to use it. So we were really kind of inspired by the preprint servers archive, which has been around in the physical sciences since the 90s, but more recently preprints are getting more popular in the kind of biological sciences. So we kind of took inspiration from them to publish pretty much immediately. And then we still have the formal peer review process, but we do this post-publication. So the idea behind this is kind of removing any delay and kind of allowing authors to share on their own terms and quickly. We also felt there was this kind of overemphasis on traditional research articles. So we're not trying to get rid of traditional research articles. We still kind of recognize the merit of these, but we often were finding that researchers had outputs that wouldn't kind of necessarily fit into a very neat traditional research article, and kind of smaller outputs, negative outputs. So what we wanted to do was allow the platforms to publish a range of different article types. So I've listed some here. So from kind of method articles to study protocols, software tools, data sets, research notes, which are kind of a very condensed version of a research article. So really kind of allowing all outputs to be published, those that don't necessarily kind of fit into the traditional research article story. And also really by doing this is that we kind of reduce research waste, and also really importantly credit researchers for all the different outputs they're producing. We also wanted to tackle what we kind of foresaw as kind of bias in the system, particularly publication bias and editorial bias around, again, negative results and things like replication studies, which are often seen by traditional journals as kind of not important to publish or not as popular. So we kind of wanted to hand that control back to the authors and kind of say, you know what's legit to be published, and what could be useful to the community. So I'm really having this kind of transparency throughout the process. So this starts with the authors. At our pre-publication check stage, we ask them to make any data that's appropriate as open as possible. So we can help authors deposit this in a suitable repository in line with the FAIR guidelines. So ensuring that kind of transparency is throughout the process and the data is available for anyone who would kind of want to replicate the study. And then we continue this throughout the process as well. So also our open peer review process, where the review reports are open to anyone accessing the paper. And then we also have the reviewer's name and affiliation as well. So I'll now go into a little bit more detail about how the publishing process works. So one of those article types I showed you will be submitted to the platform, and then at this point is checked over by our editorial team. So the idea is our editorial team are really just kind of doing sanity checks on the paper, so kind of checking it's not plagiarized, methods are adequately described, kind of similar checks to that, checking, it reads all okay. And then also at this point, we enact those open data policies, so helping the authors to deposit their data accordingly. The paper passes all those checks, and then it goes through our production team, and then it can typically be published on the platform within about a week to 2 weeks. At this point where it's published on the platform, it's an open access article, it's got a DOI, it's citable, but it's clearly labeled that it's awaiting peer review at this point, if anyone cites the paper. And then we start this peer review process post-publication. So we ask authors to suggest referees. We check them out for kind of conflict of interest and check they're suitable to review the paper. And then we invite the referees on the author's behalf, as a normal journal does. And then when we get the review reports back in, we give them a quick check over, but we publish them pretty much immediately with the reviewer's name and their affiliation. We also ask the reviewers to choose a status for the paper, which are these 3 symbols up here. So the green tick means the paper is technically sound in all forms, so it's an approved status. The green question mark is approved of reservations, so basically like a major revision, so some revisions need to be done to make the work technically sound. And then a red cross is not approved, so there are some kind of fundamental flaws of how the work was carried out. So articles, once they're published and they're awaiting peer review, they're indexed in Google Scholar and Europe PubMed Central as preprints. But we need an article to receive either 2 approved statuses or 2 approved reservations and an approved status to be indexed in PubMed Central. So those are kind of minimum requirements for indexing. If the paper doesn't initially receive those statuses, then the authors can revise the paper, publish a new version, and then the referees can reassess the paper. If they feel it's improved sufficiently, then they can update their status. So just to illustrate that process a bit more, this is a paper we've published recently that's awaiting peer review. You can see that kind of clearly labeled here. And then this is also in the square brackets behind the title as well. So this always forms part of the citation. So if anyone is kind of citing the paper at this stage, then it's clear that the paper hasn't undergone the peer review process. And then this is the paper that has undergone peer review. I actually put this in before I knew Bridget was joining the call, but it's Bridget's paper, which is a really good example of how the process kind of works. So you can see here we've got the 2 reviewers' names and their affiliations. We also encourage co-reviewing as well. So we think it's a good way to kind of get early career researchers involved in the process. So often you'll see here multiple names listed. So we kind of encourage early career researchers to review with their PI, but also receive credit for it. So you can see here reviewer 1 gave the paper an approved status and reviewer 2 gave it an approved reservation status. And then you can see it says read here, so you can read the review reports. I've just pulled them out onto the next slide. So you can see here we've got the reviewer's name and their affiliation. Each review report also has its own DOI as well, so you actually can cite the review reports, and it also has a view counter, which you can see here. We have the reviewer status for the paper, and then the review report itself, so open for anyone to read. And then the way we encourage the revision process is that authors respond directly to the reviewers on the paper. So what we have found is that it's a bit more of a dialogue process between authors and reviewers to kind of help improve the paper. And it's kind of a bit more transparent and open. When the authors revise the paper, we also ask them to fill in this amendments box, which make it clear what's been changed from the previous version. And then you can see here the paper with the version 2 published. So you can actually access all the previous versions of the article as well. And then you can see here with the version 2, both referees re-reviewed the paper. Referee 2 felt it had improved sufficiently, so updated their status to a tick. So the paper would have been indexed in PubMed at this point, and you can see that's also updated in the square brackets. The nice thing about this versioning system as well is it's a bit more flexible. So what we can do is we can publish small updates of articles at any point as well. I think this is particularly useful for things like method articles where, say, you've kind of tweaked the method 6 months later. It's not really enough to publish a whole new paper, but you can kind of go back and keep your old paper cohesive for anyone using that method. So yeah, I think it's a nice versioning system. So how's it going kind of so far? We've been going kind of 2 years. This is quite a busy looking slide, but I kind of just really wanted to highlight the breadth of what we've been publishing. It's really kind of reflected the broad range of what HRB funds. So a lot of kind of aging content and maternal and child health. We've got kind of more traditional research articles here, but also kind of study protocols. We have one on pregnancy yoga, a systematic review on men's health, case reports as well, a method article and data. So yeah, I think it's been really good to show that the platform kind of works for a range of research and for a range of researchers as well. These are some numbers I just pulled from the kind of birthday blog we did at the end of February. So they are slightly outdated now. So we've actually published 85 articles, which is exciting, and obviously a slightly larger number of authors. But again, I think it's been good to see how popular the platform is going to be. And I'd say particularly amongst our funder platforms, it's very popular with the early career researchers, which I think is great to see. I think there's a lot of advantages in terms of kind of building up your academic CV. Often at the start of your career, you could be kind of gathering negative data. So this is a good place to kind of publish it and also get that credit for it as well. And also be able to engage with members of your kind of research community through the open peer review process. Speed of publication, we're really pleased. We're kind of looking at around 76 days from submission to 2 peer review reports, which is kind of comparatively quicker to other open access journals. And as well as a range of different kind of researchers publishing on here, we've had all the different Irish institutions as well, which is great. And we're also the first most used publication venue for HRB researchers, which is a really great stat. And 12% of all open access HRB funded outputs are published here as well. I also put in this graph as well to show that we've started to get citations for what's been published on the platform as well, which is really encouraging to see. So we've had 42 citations in total. So especially as well, because the platform's fairly young, we wouldn't always necessarily expect to see citations at this stage. So I think it's a good measure of what's been published here is impactful and is, yeah, it's kind of being cited by the wider community too. I also wanted to mention is that we have collections on HRB Open Research as well. So these are kind of mini hubs that showcase kind of relative and can group kind of relative content. So kind of thematic content where we've got one for aging populations, maternal and child health, and then also one for the networks as well. So we're particularly kind of hoping to set up more for the HRB networks this year to almost kind of give them a mini journal. So maybe one for the palliative care network at some point. So this is just showing you what the HRB trials methodology one looks like. So we've kind of got articles here, and they also have their own about page as well. So papers are kind of just tagged accordingly. And we've also just launched a COVID collection on the platform as well, to complement HRB's rapid funding call. We've had a couple of papers published there already. So yeah, it's good to kind of showcase this venue as a fast publication venue in this crisis. Finally, I kind of just wanted to end on kind of our long-term vision for the HRB platform, but also kind of all the funder platforms that F1000 us were kind of involved in. So I think particularly we want to show that this publishing model works effectively and that it can accelerate impact of work. And that researchers kind of continue to embrace their approach, and that ultimately really the publisher role changes from what can traditionally be seen as a kind of gatekeeper role to facilitating getting what the research community needs to get out. But I think kind of the idea behind this is that all kind of players need to be involved in this, from publishers, funders, to research institutions, to kind of make sure that we're evaluating everyone on kind of the same level. And I think ultimately, yeah, shift these incentives to reward scientists for carrying out best research practices, and I would add an open research practices, rather than kind of being rewarded for publishing in perceived high impact journals. So I hope I've kind of made it clear why this is hopefully a good venue for your work. So kind of speed, inclusive, open, reproducible, transparent, and then also that visibility as well. So kind of with us being recently indexed in PubMed. And also just eligibility to publish here. It looks really confusing, but I promise you it's not too bad. So basically, the platform is open to all HRB grant holders from January 2017. We'll likely kind of be extending this earlier as well. But the idea is you only need one HRB funded grantee on the paper, so just a minimum of one. And then once you've got one HRB funded author on the paper, the work you publish doesn't have to be HRB funded. So the eligibility is with the grantee, but you could publish stuff that was SFI, IRC funded. So yeah, hopefully most of you, if you're not HRB funded yourselves, you likely have a colleague that is. So yeah, I would hope that the platform is open to most of you. Cool, thank you so much.
Just want to say thank you for asking me to come in and talk about my experience of publishing so far on HRB Open Research. I come at it from two angles. Not only have I been working to publish on the platform and continue to work to try to publish on the platform, but also I'm Assistant Director of Teaching and Learning for the Structured Population Health and Health Services Research PhD program. So we're actively supporting our scholars to publish their HRB funded research on this platform and get it out and accessible as soon as possible. So you've already seen this one. This was a paper led by my colleague, Dr. Peter May. And we were estimating population need for palliative care over the next 26 years using tilde data and other accessible data. This was one example. As you can see, and Vicky's gone through most of it already, but I think it's worth highlighting. Our first version was published on the platform on the 3rd of December, which was about 2 weeks, a little less than 2 weeks from when we submitted it. And then through that peer revision process and the revision and then the recheck, we were up in less than 2 months. So it was a very quick process, even over the Christmas holidays, to have the paper up and reviewed and ready to go. And I know Vicky has pointed it out already too, but although a lot of us are HRB funded that are in the project team, this specific piece of research wasn't funded by the HRB. It was funded by the HSE in their positive aging initiative. So there's a perfect example of how researchers who are HRB funded can still fund research or still publish research that's not specifically funded by the HRB within the platform. What's also nice is that we can go back very quickly all the time and look at how many downloads the papers have and the kind of views it's getting. Gives us not just the citation metric about how much interest there is in the paper, but also another way of looking at what the interest is. Yeah, and this has been gone over too, but there are a wide variety of types of papers on there. I invite all of you to go and look through what's on there and to read through comments, just to get yourself an idea of what it looks like to engage with the peer review process on here. But this is another one that we have put up in mid-March. It's a systematic review looking at the effectiveness and cost effectiveness of out-of-hours palliative care. This was a HRB funded project. And the paper is up there now, currently awaiting peer review. But in the meantime, it's had multiple views and downloads. So again, we're getting that information out there quicker. You've heard about the value of HRB Open Research from the publisher, but I might tell you from experience as a researcher why it's valuable and why I encourage our scholars to use it where we can. And I also talk to my colleagues about it. It's a rapid route to publication, so you could technically have a paper out there very quickly. It means that your work is already getting exposure and that you're making sure that relevant findings are in the public domain as soon as possible. It's also really flexible, and by flexible I mean that you're not having to adhere to perhaps a 3,000 word count or one table or two table, other things. It gives you more space, particularly for mixed methods research. These can be quite lengthy papers, and so you have a bit more flexibility in terms of what you can publish. There's fewer guidelines about exactly the word count and other types of things. So that does offer a bit of ability to perhaps explore your findings a bit more, or to develop multiple work packages within it, like, for example, a mixed method study. It's transparent, and I really like this about the HRB Open Research platform. You can also see the peer reviewers are named, and so anything that they report back is also in the public domain. That way people see that you've received feedback that's actually about improving the paper, and it also encourages that people are supportive and polite with each other in a way that perhaps the blind peer review sometimes doesn't encourage as freely. And for early career researchers, that can be really important to feel that this is a transparent process, and they're not left with the bad peer review, or perhaps stinging peer review that they might not get otherwise. It's low cost, so you don't have to be looking for ways to fund your research perhaps after a grant is done and the research is still sitting there. You can get it published without having to come up with the money to pay for it. And then the indexing and the accessibility. So, PubMed indexing is a great advantage, as is the Google Scholar, but just having something come up on the internet, a lot of people start with a search for papers they need just by doing a regular old Google search. So this is a great opportunity to get your research noticed. A few things about the process. I know they came up, but more from an experience of doing it myself. Make sure you prepare your manuscript well, that there's no typos, that there's no other major issues, and that you keep within the very few guideline or advice recommendations that they have within there. And that you have your supporting documentation in order, so that your figures and your tables and everything are the way that they should be before you submit it. That will speed the process up. I know the 10 reviewers was mentioned. I am already at 10 reviewers for my out-of-hours systematic review, and we have not had a successful bite yet in terms of reviewers. So I would probably have more reviewers. It would be my advice right now to identify perhaps as many people as you can, even if you're not submitting all those names at the same time. And in terms of engagement with the peer review process, I'll give you a few of my own thoughts about it on the next slide. But this is a really critical part about, as everybody knows, irrespective of the platform, that positive engagement with peer review is really important. People are giving their time freely to help get your research improved and to get it accessible to others. So to make sure that you are engaging thoroughly and positively with the peer review that comes through. So my advice for people who are looking to use the HRB, when I talk to scholars and others about it, is, again, to make sure things are in order, to think about how you're going to make your data available before you approach the platform perhaps, but then you can also make your queries if you need to. If you have data that can't be anonymized and that you can't make freely available, that's absolutely okay. You just need to engage with the editorial team and let them know what your circumstances are and work with them on a solution for that. But it's good to identify within your study which parts of your data would be feasible to make available, and to make those arrangements and to make sure that they're within the guidelines that are on the HRB Research Open website. Identify more than suggested in terms of reviewers, definitely right now. And I think for several months this is going to continue to be an important development in terms of peer review. Addressing the peer reviewers' comments when they come through, make sure you're thorough. I often tell the scholars a really important part is perhaps to just copy and paste all the reviewer comments into Excel or some other sort of table, and make sure that you address every point. Again, to not be argumentative, but to look at this as an opportunity to improve your work, to take and incorporate feedback where it's helpful, and then to state your case more clearly with supporting evidence where you don't agree with review, but to do so in a positive and gracious way, and also to thank the reviewers for their time because they are giving it freely. And then to share when you have something published, or somebody you know has something published. Put it on social media, put it on blogs. Don't wait for it just to get the traditional citations or sort of coverage that way. but be active in sharing what's happening on HRB Research Open. Check it out yourself often and read the reviewer reports and other things going on in there. And really importantly, that you don't just focus on tweeting or blogging or writing about your own research, but spend time promoting the research outputs of others that are here on HRB Research Open now, or Open Research now, so that other people can see just the wide variety that's out there and the experiences that people are having. That's it.